I'm Dr. Ramesh from Aradamansara Medical Center. I've been a neurosurgeon for 23 to 25 years now. I always find patients and their family members are always afraid of brain tumors. So I'm trying to allay your fears that brain tumor can be treated and you can lead back to a normal life. Today is World Brain Tumor Day, and we thought it's a good opportunity to help you all understand more on brain tumors. Let's start with what is a tumor. The word tumor comes from the Latin word which means new growth. Tumor doesn't mean it is a cancer. Okay? A new growth can be benign or non-malignant or maybe malignant. And this is confirmed by histopathological examination, where the tumor cells are sent to the lab and looked under a high-powered microscope to see what is the cell of origin. This is done by a pathologist. What is cancer? Cancer is aggressive growth with local invasion and distal spread. It's always malignant, but it's actually very rarely in brain tumors. The only rare brain tumors that can spread to other parts of the body is medulloblastoma or hemangiopericytoma. So most people are worried when they talk about cancers. What are the chances of getting a tumor? The global incidence is only 17.3% per 100,000 persons. This is according to the British Lancet in 2019. Unfortunately, brain tumors also occur in children. 1 in 12 primary brain tumors occur in children under 15 years. But what is it in Malaysia like? This was taken from the Malaysian Cancer Registry in 2005. This was when I was one of the expert panel members for the National Cancer Registry. And between 2002 and 2004, only 8 per 100,000 population for men and 6.1 per 100,000 population for females. If you go by age, the highest percentage is 22.1 for men in the 60 to 69 year age group and 14.5 in women. So how do brain tumors present? What we call progressive neurological deficit. I'll explain further on that. And it is usually a motor weakness, but it can also be a sensory weakness, headaches, and seizures, right? So, let me talk first about headache, because headache is something that everybody experiences. And when patients come to me with a headache, now I say I've got a headache to decide whether you've got something serious in your brain or is it just a usual headache. There are so many, there are primary and secondary headache. Okay, as you can see on the screen for those of you all who are on Facebook Live. Now symptoms, paralysis. Okay, so if your right brain has got a lesion, you're paralyzed on the left side. If your left brain has got a lesion, you're paralyzed on the right side. Then you can also have paralysis of the eyes, right? Here there are pictures showing that paralysis of the eyes, which is something affecting the nerves of the eyes. You can have visual deficits, okay, where your vision is actually sort of half or partially clouded. And it is rather unfortunate that a lot of people actually go and see the optician first before seeing the ophthalmologist, and find out very late that they actually have a tumor in the brain. Double vision does not always mean that you need to change your specs. It could be something a bit more sinister. Hearing loss, dizziness is another symptom. Okay. Of course, dizziness is also a frequent symptom like headache and may not always mean a brain tumor, but if you have recent onset of dizziness, persistent dizziness, or recent onset of hearing loss, then you probably need to see your neurologist or neurosurgeon. Swallowing, change in voice could also show early symptoms of something in the brain. As I mentioned earlier about headaches, how do you know whether this is your normal headache, migraines, which a lot of people suffer from, or is it something else happening in the brain? The symptoms what we look for is recent onset of headaches, persistent headaches, and may be associated with neurological deficits. Brain tumors are divided into primary and secondary brain tumors. I'm not going to read all. There are actually 24 different types of brain tumors. These are only the common ones that I'm mentioning: astrocytoma, oligodendroglioma, germinomas, okay? And each of them behave differently. Most of the patients who come and see me tend to assume that brain tumor is one. It is not one, it's different. The treatment of each one is different as well. Besides primary brain tumor, you got secondary brain tumors, which is spread from other systemic tumors. This is what we call cancer. It spreads from lungs, breast, colon, kidneys, skin, to the brain. This is one of the very common things that patients always want to know. Why do I get brain tumor? Now, the actual truth in the answer is we do not know. But a few risks of brain tumors that we are aware of is increasing age. Like I showed you the Malaysian Cancer Registry, where between 60 to 69 has a slightly higher risk of brain tumors. Medical radiation, that is ionizing radiation, that is radiotherapy. Family history and genetic conditions. There are a few that I've, like neurofibromatosis, tuberous sclerosis, Lee-Fraumeni, and a few others. So how do we detect a brain cancer? One is by a CT scan of the brain, magnetic resonance imaging of the brain, or sometimes even a CT angiography. So once we have found out there is a brain tumor, how do we treat it? The options are a few. One is surgery. Surgery can be an open craniotomy, endoscopic ventricular surgery, endoscopic skull-base surgery, radiosurgery or radiotherapy, which is usually for tumors less than 3 centimeters. And it doesn't actually make the tumor disappear, but it reduces the chance of tumor growth. And the third one, which most of my patients like, is expectant monitoring. So small tumors, usually less than 2 to 2.5 centimeters, not causing any compression on the brain, I usually advise them on a yearly imaging follow-up. So what is the goals of surgery? We want to look at accuracy, safety, and efficacy. Accuracy means the diagnosis and localization of the lesion. Safety means leaving the patient with minimal neurological deficit. Efficacy means a low rate of tumor recurrence. Now, most of the patients who see me for brain tumors usually do ask, is it excisable? What we really look at is, most of the brain tumors are excisable. What we look for is a corridor that gives limited damage to the surrounding brain and goes straight for the tumor. So we have a number of surgical tools which do assist us, like operating microscope, intraoperative fluorescence, angiography, image-guided neuronavigation endoscopes, and many others. So today, brain surgery is very safe because of the advances in medical equipment. Now, unfortunately, those on Instagram can't see the slide. This is a patient of a brain tumor. In planning his surgery, we used fiber tracking MR imaging. What is fiber tracking is the MR helps us to highlight where the major structures or the tracks where the nerve fibers run and its relationship to the tumor. So using that and our image-guided navigation, we can actually target the tumor with minimal destruction of the surrounding brain, or most importantly, the tracks, as to not to leave the patient paralyzed. What is neuronavigation is what I usually explain to my patients in terms of, it's like your GPS in your car. So you can see on the map at any time where you are. Likewise, with this neuronavigation, we can see on the MRI exactly where we are. So is surgery possible for all tumors? Now this is a very deep-seated tumor. It's a tumor actually just behind the eye in the center of the head for those on Instagram. And this tumor was completely removed, although it was deep-seated, and patient was perfectly well. Now we have another tool removing brain tumors, which is an ultrasonic aspirator. The video here actually shows how we are removing the tumor from the brain and not removing the brain from the tumor. So we hardly touch the surrounding brain and just remove the tumor. So this makes surgery safe and does not leave any deficits to the patient. For those on Instagram, these videos will be posted later. Right, this is another video of our surgical option of using neuroendoscopy. A lot of patients come and ask for minimally invasive surgery. using scopes. So even in the brain, we can use a scope, but it's not for all types of surgeries, but some surgeries. Here, for those on Facebook, can see that the tumor being removed through the endoscope, right? And then we are creating an opening to divert the CSF flow, okay? So the patient doesn't need the shunt. Here you can see it working well. After doing the surgery, we have another tool, MRI CSF flow studies. So it can actually show you that the opening that was made earlier is functioning well, and you can actually see the flow of the CSF. These are all advances in medical sciences that makes brain surgery safe and efficient. This is another picture of skull-based navigation, same like previously I told you, navigation. So if you can, there's a pointer which when you point at that part of the human body will tell you on the MRI exactly where you are. So tumors that are right behind the nose, adjacent to the eyes, we can actually remove endoscopically through the nose. No surgical incision. You can see, for those of you on Facebook Live, you can see the tumor here being gradually removed. It's a safe surgery, short-term hospital stay. So we use everything from endoscopes to open surgery to microscopes for removal of tumor. Right? Now, the last one which I mentioned just now was stereotactic radiosurgery or gamma knife surgery, which a lot of patients are very keen on because it is non-surgical. When we actually look at the study presented in the Journal of Neurosurgery Skull Base in 2014, it shows that the tumor control was only about 50%. Arrested growth is only 34%. And 14.7, it actually increased. So gamma knife actually does not remove the tumor. It reduces the growth in tumors, but also some tumors like neurofibroma and meningiomas, the described growth rate is only about 2 millimeters a year. I have patients right now on 10 years of my follow-up who is coming for a yearly MRI, and the tumor has never grown. They had no radiosurgery, they had no open surgery. It's just the natural history of the tumor itself. So brain surgery is actually very safe. And for gamma knife or radiosurgery, stereotactic radiosurgery, the tumor has to be less than 3 centimeters. So a 4-5 centimeter tumor will have to go for open surgery. And it is safe because we have a lot of tools to make it safer. We have good MRI images to make sure that we actually localize the tumor, localize the important surrounding structures to be able to perform safe surgery. Now when it comes to MRI, a lot of patients do ask me whether they can take an MRI anywhere. But an MRI is like your mobile phone. The better your camera, the better the images you get. So an MRI, like a 3 Tesla MRI, will give you good images and help the surgery. Enlightening experience for y'all. And brain surgery is safe. Don't be afraid, although the risks are there.